Prime Minister Narendra Modi interacts with state chief ministers through video conference, urges leaders to formulate plans to improve the lives of ordinary people, emphasizes 2 yards mantra to tackle COVID-19. ICMR advises states to stop using rapid test kits from China, asks states to return all kits, assures countrymen that there is no shortage of testing kits. People who are clinically diagnosed to have very mild COVID-19 symptoms or are in the pre-symptomatic phase now to have the option for home isolation. Health Ministry issues guidelines. Health Minister holds video conference with 10 major healthcare institutions including AIIMS across the country, asks them to be prepared for the challenges to come. Hospitals say they have no shortages of any kind. Number of active cases of corona across the country stands at 21,132. 886 people have died due to the virus. 6,361 patients have recovered so far after treatment. As global tally of COVID-19 cases increases to more than 30,40,000 and the death toll crosses 2,11,000, WHO warns pandemic far from over, raises concern over vaccine shortages, disruption of normal health services world over. Good morning. Welcome to English News. I am Anil Thomas. Now for the stories in detail. Prime Minister interacted with chief ministers of the states. He pointed out that the lockdown had saved thousands of lives and asked them to motivate people to download Arogya Setu app, which would help in detecting an active coronavirus carrier. He highlighted the importance of technology in the battle against COVID-19 and in bringing in reforms that touch the lives of common citizens. Here's a detailed report.
As India enters final week of the lockdown, Prime Minister Narendra Modi on Monday conveyed to the chief ministers that the country will have to give importance to the economy as well as to continue the fight against coronavirus. Prime Minister had interactions with many chief ministers via video conference. Prime Minister underlined that the lockdown has yielded positive results as country has managed to save thousands of lives in the past 1.5 months. The situation in many countries, including India, was similar at the start of the month of March. However, due to timely measures, India has been able to protect many people. Prime Minister, however, warned that the danger is far from over and constant vigil is of paramount importance. Prime Minister further said that the country has seen 2 lockdowns and now it has to think of the way ahead. Quoting experts, he said that the impact of coronavirus will remain visible in coming months. He reiterated his mantra of Do Gaz Duri and added that masks and face covers will become part of our lives in days and months ahead. Prime Minister said that we have to give importance to the economy as well as continue the fight against COVID-19. Prime Minister also highlighted the importance for state governments to enforce guidelines strictly in the hotspots, that is, in the red zone areas. He said that efforts of the state governments should be directed towards converting the red zones into orange and then finally to green zones. On their part, the chief ministers praised the leadership of Prime Minister during this period and highlighted the efforts undertaken by them in containing the spread of COVID-19. They spoke about the need to keep a vigil on international borders and also on addressing the economic challenge and ways to further boost health infrastructure in the country. The leaders expressed gratitude towards the police force and the medical staff for the work done by them in the fight against COVID-19. This is Prime Minister Modi's 4th such interaction with chief ministers since March 22, when he first spoke to them on the situation and steps taken to contain the pandemic. 2 days later, on March 24th, Prime Minister announced a 21-day nationwide lockdown. He extended the lockdown till May 3rd on April 14th. Newsnight Desk, DD India.
The Indian Council of Medical Research on Monday asked the states and union territories to stop using the rapid antibody COVID-19 testing kits procured from China. Spokesperson in the Health Ministry assured that at the level of ICMR, we have sufficient amount of kits as far as RT-PCR test is concerned. Not only sufficient amount of kits are available, but we also have parallelly ensured geographical adequacy. The centre has said that the discrimination against the frontline workers is uncalled for and the stigmatization is a huge impediment in a fight against COVID-19. Centre has said that the stigma should be addressed through an intensive campaign. Government added that there is no risk of transmission from recovered patients. They, in fact, can be a potential source of healing for antibodies using plasma therapy. Centre has appealed to all that they should avoid spreading misinformation and panic, and no community or area should be labeled for COVID-19 spread. Spokesperson in the Ministry of Home Affairs said that over 2 crore people got employment through Manrega in the country till now. Ministry of Health and Family Welfare has issued guidelines of home isolation for appropriate management of suspect or confirmed case of COVID-19. The guidelines must be followed by clinically assigned pre-symptomatic patients. Patients must have requisite facility for self-isolation at the residence. Also, a caregiver must be available 24/7. All caregivers and close contacts must take HCQ tablets as prescribed. Arogya Setu app must be downloaded and must remain active via Bluetooth and Wi-Fi. Meanwhile, patients must fill the undertaking before self-isolation as provided by the government. They are also advised patients to seek medical attention if serious symptoms develop. A patient to end self-isolation only when the health officer clinically certifies them free from infection. Caregivers should wear triple-layered medical mask and avoid touching its front portions. They must follow proper hand hygiene while contacting ill persons and wash hands often for 40 seconds. They should avoid direct contact with patients and avoid exposure to contaminated items. Also, caregivers must self-monitor their personal health. Government also provided instructions which must be followed by patients under home isolation. Patients must wear triple-layered medical masks. Masks should be discarded only after disinfecting it with 1% sodium hydrochloride solution. Patients should stay in identified rooms and maintain adequate hydration. They should follow proper hygiene and wash hands often with soap and water. Patients should also clean the exposed surface with hydrochloride solution and self-monitor his or her health with daily temperature monitoring. Union Health Minister Dr. Harshvardhan held a video conferencing with directors of AIIMS located across the country as well as JIPMER Puducherry and took stock of the preparation in view of COVID-19. The meeting saw the Union Health Minister call upon all these institutions to ready themselves for future needs as well as assured of giving all possible necessary help in the future.
उनके सामने एक तो वहाँ पर जो कोविड के लिए उन्होंने तैयारियाँ की हैं, बेड्स के मामले में, लेबॉर्ट्री टेस्टिंग के मामले में, पेशेंट्स की केयर के मामले में, और इसके साथ साथ भविष्य में भगवान ना करे तकलीफ़ ज़्यादा हो जाए देश में, तो उस समय के लिए उनकी क्या क्या तैयारियाँ हैं, एक तो उसका सारा रिव्यू किया है। उनको अगर किसी और चीज़ की भारत सरकार की तरफ से आवश्यकता है तो उसके बारे में भी उनसे हमने पता किया है। मान लीजिए उनको और वेंटिलेटर्स चाहिए और उनको कोई पीपीई किट्स वगैरह चाहिए, लेकिन मुझे खुशी है कि सबने मोटे तौर पर ये कहा कि उनके पास सब कुछ पर्याप्त मात्रा में है, लेकिन हमने उन्हें विश्वास दिलाया कि आपको जो कुछ भी चाहिए वो आप लीजिए।
Meanwhile, 21,632 active cases of COVID-19 have been reported across the country on Monday. 934 people have lost their lives, while 6,868 people have been cured and discharged from hospital. Human Resource Development Minister Ramesh Pokhriyal Nishank on Monday interacted with parents across the country through webinar in view of the circumstances arising out of COVID-19. During the interactions, the parents posed questions on some crucial issues concerning their kids. On the question of the availability of NCERT books, the HRD minister said that the NCERT has sent books to almost all the states and very soon these books will be available to the students. Responding to the question on conducting the remaining exams of CBSE 10th and 12th, the Union Minister said that the examination in 29 core subjects will be conducted at the first possible opportunity. In response to the question of how to reduce the loss of students' education in the lockdown, he said that the education of students is continuing through the various online platforms of the ministry. He informed that more than 80,000 courses are available only on the ministry's Diksha platform. He also informed that e-learning in the country has witnessed an appreciable upsurge during the past few weeks. The HRD minister will today interact with the education ministers and education secretaries of all the states through video conferencing to discuss issues like handling COVID-19, midday meal, Samagra Siksha, etc. to ensure that students continue their studies in these times. The government has initiated action against 3 senior Indian Revenue Service officers for their role in drafting of a report that gave suggestions to the tax department to boost revenue generation amid the coronavirus pandemic. The tax department has found them in violation of the various central civil services rules and issued charge sheets against them. They have been divested of their current charges for now. This action has been taken by the CBDT in view of their role and complicity in the preparation of the tax hike report named Force, which was being circulated and widely covered in media since April 25th. The report advocated tax hike, imposition of wealth tax, inheritance tax, imposition of COVID-19 surcharge. The report created panic and tax policy uncertainty in the already stressed economic conditions in the country. The number of positive COVID-19 cases rose to 546 in the Union Territory of Jammu and Kashmir as 23 new positive cases, 22 from Kashmir Division and 1 from Jammu Division were reported on Monday. Out of the 546 positive cases, 375 are active positive, 164 have recovered and 7 have died. Moreover, 27 more COVID-19 patients have recovered and discharged from various hospitals. Now, the total of positive corona cases in Jammu Division has climbed to 58, whereas the number of positive cases in Kashmir Division rises to 488. Rising to the occasion, Mumbai Mayor Kishori Pednekar has decided to return to her old calling, nursing, to contribute in the fight against COVID-19. Pednekar was a nurse before coming to politics and has decided to join the team of BMC's BYL Nair Hospital to aid the COVID-19 patients in their fight against the virus. The mayor has tweeted, "Anything from Mumbai, we can't do work from home. We are on the field for you. Stay at your home. Take care. Hashtag COVID-19 at Nair Hospital." The Madhya Pradesh government on Monday have banned spitting in public places to contain the further spread of the deadly COVID-19 infection. The state government decided to slap a penalty of 1,000 rupees on those who are found violating the ban by spitting in public places. Urban Development and Housing Department has issued an order in this regard on Monday. The commissioners, chief municipal officers of urban local bodies have been authorized to slap the penalty in the areas of jurisdiction. The state government has already banned the sale of gutka and pan masala till further orders to contain the pandemic. World Health Organization or WHO has warned that the new COVID-19 pandemic was far from over. Speaking at his regular briefing in Geneva on Monday, WHO Director General said that he was deeply concerned about the impact of the disruption of normal health services, especially on children. Noting that several European nations are preparing to ease coronavirus-related restrictions, the head of WHO urged countries to continue to find, isolate, test and treat all cases. He added that the WHO body was concerned about the increasing trends in Africa, Eastern Europe, Latin America and some Asian countries. The WHO DG also expressed concerns that some of the efforts to stop the spread of COVID-19, such as closing borders, has resulted in the shortage of vaccines against other diseases in 21 countries. WHO DG has urged worldwide solidarity to stop the spread of COVID-19. He said that if people are not united, the virus will exploit the divisions between individuals and continue to create havoc, leading to more loss of lives. He said every life is precious. WHO's top emergencies expert Mike Ryan said that the United States seemed to have a science-based federal plan for fighting its coronavirus epidemic.
As lockdowns in Europe is with declining numbers of new cases, we continue to urge countries to find, isolate, test and treat all cases and trace every contact to ensure these declining trends continue. But the pandemic is far from over.
Meanwhile, 30,41,764 confirmed cases have been reported from across the globe, while 2,11,167 people have lost their lives due to COVID-19 globally. Another 4-digit increase in the United States. The United States of America recorded 1,303 deaths due to COVID-19 in the last 24 hours, as per the Johns Hopkins University tally. The U.S. now has an overall death toll of 56,144 with 9,88,189 confirmed infections. The total number of people recovered in the United States stand at 1,11,197 people. However, certain restrictions have been lifted in several states, but shopping malls remain closed. Washington state will reopen some outdoor recreation on May 5th, while Texas will ease certain restrictions and restart business soon in phases. Meanwhile, U.S. President Donald Trump said that he would consider easing the sweeping travel restrictions he imposed on European countries depending on how the continent responds to COVID-19. Meanwhile, the death toll from COVID-19 in Spain topped at 23,520, while the total number of cases stand at 2,29,422 in the country. Spain has let children go outside and play for the first time in 6 weeks, as European countries methodically worked to ease their lockdowns and reopen their economies after the dampening effect of the virus. Moving to Italy in Europe, where 7 weeks into strict lockdown, Italy's Premier Giuseppe Conte has announced the reopening of some of the public spaces like parks and gardens. Funerals will be allowed, training of athletes will also be resumed, and people will be able to visit relatives living in the same region from May 4th. The death toll from COVID-19 in Italy has surpassed 26,977, with the total number of cases of more than 1,99,410. Moving to South America, Venezuelan President Nicolas Maduro announced that the elderly people and children will be able to break the lockdown from the 27th of April. The lockdown was imposed to halt the spread of COVID-19. On the same day of this announcement, many elderly people were already seen out in parks taking advantage of the new relaxation. Maduro imposed a nationwide quarantine on the 17th of March, ordering people to stay at home and non-essential businesses to close. According to the Venezuela government, there has been 325 confirmed cases of the virus and 10 deaths. Meanwhile, dozens of frontline workers at several Peruvian hospitals took to the street of Lima and Callao to protest a lack of personal protective equipment or PPEs as doctors and nurses struggle to deal with effects of COVID-19 pandemic. The medical workers held placards with slogans that said, "I don't want to die," and "Rapid test for all," as they protested in front of their hospitals to demand more PPE equipments. Peru has been hit hard by the coronavirus, and last week the government extended the national lockdown to May 10th. Peru recorded its first coronavirus or COVID-19 case on March 6th and took 25 days to reach 1,000 cases. Cases doubled again, reaching about 20,000 confirmed cases in the South American nation. Peru has more than 780 deaths due to COVID-19. Coronavirus pandemic has hit the world's economy. Many countries are tackling with crippling economies. Among such is the African nation Nigeria, which too has been badly hit by the crisis. Seeing the cascading economies, countries are now chalking out plans to ease the lockdown in order to give some breather to their economies. In a similar move, Nigeria will begin a phased and gradual easing of more than 4 weeks of lockdowns in the national capital and the largest city on May 4th. President Muhammadu Buhari said in an address on Monday that Lagos and Ogun states and the Federal Capital Territory of Abuja entered lockdowns to tame the spread of the new COVID-19 on March 30th. Confirmed cases of the new virus have roughly quadrupled since a lockdown extension was announced on April 13th to 1,273 cases and 40 deaths, most concentrated in Lagos and Abuja. Back to Asia and China, the world is facing the critical global health challenge of COVID-19 pandemic. The international community at this time needs solidarity and cooperation more than ever. These statements were made by Chinese President Xi Jinping, calling on the world to safeguard multilateralism. President Xi Jinping made the remarks in a telephonic conversation with Nepal President Vidya Devi Bhandari, pledging that China will continue to support Nepal in fighting the pandemic. The Chinese president suggested that health and medical agencies of the two countries will enhance the exchange and cooperation effectively. Government of Bangladesh will operate 6 more flights from India to bring back its stranded nationals back into the country. The national carrier Biman Bangladesh has arranged flights on May 1st from Kolkata, May 2nd from Delhi and May 3rd from Mumbai to Dhaka. The private US Bangla airline will operate 3 more flights from Chennai on April 30th, May 1st and May 2nd to bring back Bangladeshi citizens from India. The Bangladesh High Commission in the national capital in its circular has asked the passengers availing of the special flight to bring COVID-19 free or COVID-19 symptom-free medical certificate with them before boarding the flight. Earlier, nearly 1,000 Bangladeshi nationals were brought back to the country through 6 chartered flights from India. 5 of these flights originated from Chennai, while 1 took off from Delhi. In the meanwhile, Bangladesh on Monday extended the suspension of domestic and international flights till May 7th in the country. In Sri Lanka, meanwhile, 180 Navy personnel have tested positive for COVID-19. Army Commander Shavendra Silva said among the Navy personnel affected, 112 are from Velisara camp and 68 are from those on leave. There are 434 active cases, while 7 have died and 126 recovered out of the 567 infections that have been found positive so far. The number of infections have doubled over the past week, with the maximum cases of 64 that have been reported on Monday. Meanwhile, 7 opposition parties in a joint statement urged the president to reconvene parliament, assuring responsible cooperation in order to face the COVID-19 challenge effectively. The statement said that the country is faced with an unprecedented national crisis which shows no signs of an early ending. It said as members of the dissolved parliament are duty-bound to fulfill their obligations to resolve the crisis in a spirit of responsible cooperation. He called upon all political parties across the political divide of transcending partisan agendas and working together for the common good. However, the COVID-19 outbreak has led to the postponement of elections, which is scheduled to be held on the 20th of June now. Moving to GCC countries, Saudi Arabia recorded 1,289 new COVID-19 cases on Monday, marking its highest daily increase so far, according to the Health Ministry. The kingdom also confirmed 5 new deaths, raising the death toll in the nation to 144. Meanwhile, 174 people have recovered over the past 24 hours, bringing the total number of recoveries in Saudi to 2,531. The Saudi Health Ministry has confirmed a total of 18,811 cases since the virus hit the country. In the UAE, meanwhile, 490 cases of COVID-19 were recorded as on Monday. The total number of recorded cases in UAE now stands at 10,839. The UAE Health Ministry also announced 6 deaths, bringing the total number of deaths in the nation to 82. 112 people have recovered in the country, with 2,090 recoveries in the country so far. Well, that's all we have time for in this edition of news. But remember, stay safe, stay indoors, and be positive. Thanks for watching. Bye-bye. Take care.